Hello, you're watching Health Day now. I'm Mabel Jong. Experts are split on whether the pandemic is over, but one thing is certain: frontline health workers continue to report feelings of stress, trauma, and burnout from enduring demanding working conditions while caring for people who are still getting sick from COVID and other illnesses. According to a 2022 survey conducted by the Harris Poll in partnership with HealthDay, 68% of physicians said they regularly felt rushed when caring for patients. 49% said they felt burnt out from work, and 40% said they felt isolated in their professional lives, not able to express that they're struggling. The extraordinary demands of caring for people has led to a mass exodus of healthcare workers. For more on this great resignation and its impact, Dr. Vineet Arora is here. She's the Dean for Medical Education at the University of Chicago Medicine. Thank you so much for your time, Dr. Arora.
Thank you so much for having me.
Burnout was already a big challenge pre-pandemic, but why now in particular are hospitals seeing problems with retention, and how are patients harmed when there isn't enough healthcare personnel?
Yeah, no, thanks for that important question. I think obviously 3 years into a pandemic when we already had burnout as an epidemic, labeled as an epidemic prior to the pandemic, you can imagine with long work hours, fatigue, challenges. Many healthcare workers are on the front lines of verbal and physical abuse these days, as well as just, part of the Great Resignation, if you will. They are thinking about other jobs and there are a lot of other opportunities. And so we are seeing some challenges in our workforce. What happens is you stretch the staff that you have to the capacity. So you have to take care of the patient in front of you, but when there's too many, you might actually stretch the staff and they're taking care of too many patients, or they've got too many things to do. So things get missed. And so it could be a variety of things that get missed. It's also possible that a great example is in the outpatient setting. Perhaps a patient in the community needs to be seen and they're harboring a cancer and they don't even know it. But instead of getting seen next week or 2 weeks later, they can't get seen for months and that cancer grows. That's also a safety event, right? That's a delayed diagnosis. And so there are many ways that patients are harmed because of this.
And we're not just losing workers to the great resignation, but also an aging workforce is leading to a record number of retirements. How should patients be advocating for themselves while the health sector deals with continuing shortages?
It takes 7 to 10 years to train a very seasoned healthcare professional. And so it is a really challenge right now to figure out how to bring in the new workforce when we've got an aging workforce and an aging population. In
Mhm.
terms of what patients should be aware of, I think that they should know that it's very important to establish yourself with a practice before you get sick right now. So, our prevailing notion a lot of times is I will only go to the doctor when I get sick. Unfortunately, that doctor may not be able to see you for months. So, but if you're a member of the practice, then you've got telehealth, you've got the patient portal, there could be a nurse who reaches out. There are a lot of ways that you can advocate with the practice that you're a member of.
This resignation movement has been marked by a she session. Why are women, particularly those of color, leaving healthcare? And how does it hurt when large numbers of women physicians are either cutting back or just outright quitting?
Those with intersectional identities, particularly women of color or from minoritized groups, I think we have to really think strategically about their specific needs with them at the table. And, thinking about women, and particularly women often are caregivers, and they're not just caregivers at the front line, they're caregivers at home. And so they've got young kids at home, they've also got aging parents, they're members of their communities. And unfortunately, the burnout rates among, for example, women physicians twice as high than their male counterparts. Intention to leave also much higher. The reason that very much hurts is because women take care of women, right? So now we've got women leaving at a time then when women's health and reproductive health is very important important to have access to care. We also know that teams that have greater composition of gender equity actually perform better. And so there is very strong data to show that, for example, having women in the workplace, having women in healthcare, and having women in leadership positions are all associated with very positive, strong outcomes. And that's going to be important to maintain. We cannot lose ground on this because this will set our generation back.
Dr. Vineet Arora, Dean for Medical Education at University of Chicago Medicine. Thank you so much.
Thank you so much for having me.
Another burden on the healthcare system is the administrative one, which continues to increase stress for healthcare professionals and takes time away from patient care. According to a survey conducted by the Harris Poll in partnership with HealthDay, 63% of physicians feel overwhelmed by administrative requirements on a weekly basis. Yet nearly three-quarters, or 72% of physicians, say their organization is not set up to minimize the time they spend on admin in order for them to focus on patient care. Since burnout not only impacts individual workers, but also the patients they care for, some hospital systems are trying to take what they've learned during the pandemic and apply that to targeted programs to support their frontline teams. With me now is Janet Tomkavich. She's the Executive Vice President and Chief Nursing Executive at regional healthcare provider Geisinger, a nonprofit 10-hospital health system based in Pennsylvania. Janet, thank you so much for your time.
Thank you.
In many ways, it looks like the worst of the pandemic has passed, but not for the people still on the front lines. Janet, what are the biggest challenges you're seeing on the job today?
We're really focused on keeping our healthcare providers, our employees at the bedside, particularly in our clinics. And we've really seen continued losses and turnover because folks are still struggling with the loss. That ongoing kind of exhaustion, emotional exhaustion, physical exhaustion is still well underway. And as you know, RSV and the flu is quickly coming on this fall. And so it really continues to kind of be really a burden for our teams.
Clearly, the health sector is multitasking on several fronts, but so are other industries. How difficult is it to compete with other sectors for talent?
You bring up a really great point. In the past, we competed with other healthcare systems, but now we're competing with really organizations across our footprint. And that could be Target or Walmart or any industry because they're working for or looking for workers just like we are. We have non-licensed workers, nursing assistants, patient care companions, our front desk folks, and they can go get very good jobs at other industries and not have to deal with some of the pressures that you feel in a healthcare organization.
I understand that an internal travel program within your campuses has recruited nearly 100 new nurses, and those nurses are paid more to travel within the network?
Exactly right. So back in April of last year, 21, we launched our own internal travel program, much like several other organizations across the US have done. And so you have to sign on and you have to go to one of our hospitals and you have to commit to that 24-week rotation at that particular hospital. When that rotation is up, now you're going to be assigned to one of our other hospitals that potentially has an open area as well. So once a month, we have town halls with our CEO and senior leaders so that we can address the current issues and then questions and answers that the team may have. So I think communication is really important. But I think there's a couple of other things that we're really focused on. One is work-life balance. And that's the toughest one, quite honestly, I will tell you. It's tough to be a 24/7 organization. Patients are not sick Monday through Friday, 8 to 5, right? They're sick at nighttime, they're sick on the weekends, they're sick on the holidays. So getting creative with staffing models, trying to be creative about flexible work schedules which is very challenging in the, in the inpatient environment, particularly, and really trying to work with our staff to really get creative about different types of work schedules.
Geisinger also launched a virtual nursing model that brought some nurses out of retirement. It all sounds innovative, but how can you tell that these programs are working to keep nurses? Currently, you have about a 40% vacancy rate, which sounds quite significant.
Our vacancy rate is still a little bit on the higher side, but our turnover rate in 2022 is really starting to decline. I think compensation is a clear element, and Geisinger certainly paid attention to their rates, their ability to keep experienced nurses with retention bonuses. We've addressed some of the what we call shift differential rates if you work weekends and nights. So all of those things probably needed to be right-sized a little bit, I think, in healthcare. So as we continue to build out new programs that actually help them take steps in their professional career, I think we will impact the loss.
And what about recruiting strategies to meet shortfalls still to come?
We've got to get creative about how we bring more people into healthcare. How do we create that interest in middle school and high school, in the health sciences, in nursing, in respiratory therapy, in phlebotomy? So we've got to get creative with engaging those high schoolers in a career in healthcare. And I think if we continue to get creative in those spaces, that will continue to build the workforce that we need.
Janet Tomkavich, Executive Vice President and Chief Nursing Executive at regional healthcare provider Geisinger. Thank you so much for your time.
Thank you for having me today.
You've been watching Health Day Now. I'm Mabel Jong.